Yes, few things which everybody have to be aware in terms of cancer and malignancies per se. So, to begin things, I thank Ahuja sir and also the Aparna community for inviting us here. So, why is it important for us to discuss about cancer at least in 2025? Let's say we are in 2005. We know that the hypertension, the diabetes, and the cardiac morbidity or the endemic had started back then. So we were in 2005 and we were discussing all those things we wanted to be aware, and right now after 2 decades definitely everybody of us are at least a little better aware of what to how to diagnose them, which doctor to see, what to follow after you have a diagnosis and things like that. So at least if not as someone in our family at least knows a little things, or if not in detail about all these immediate problems which are all facing post 50. So let me tell you that we are sitting in 2025. Cancer or malignancy per se is rated at number 6 in terms of the most common diseases which we are dealing with. The first one is always diabetes, hypertension, followed by cardiac, and so on and so forth. Number 6 is the cancer incidence which we are dealing with. By 2030, these numbers are projected to reach the number 3 position. So post diabetes and hypertension, the most common disease which everybody of us would be dealing with would be malignancy. So we should be future ready. If not, and also the problem with malignancies is the late diagnosis or the lack of awareness in majority of our population. So when coming to so what comes to our mind when we talk about preventing cancer, if we have to discuss in that regard? So, 2 things, modifiable and unmodifiable things are very important for us to discuss in detail. Modifiable things to prevent or to decrease our risk in getting malignancies is definitely the lifestyle modifications to begin with, and also the risk factors which we will discuss in detail. What are the important lifestyle modifications, at least which are important to prevent cancer? Definitely the one which had become important in diabetes is also very important in malignancies per se. So we tend to take this as an underrated thing, but trust me, the diet which we are eating on a regular basis is the most important thing even in malignancy per se to prevent it. So what we eat, what we should not eat will become the most important thing. So what we should not eat in our, or what to decrease in our regular diet per se is what is mentioned here. So the processed food, the sugary foods and drinks, and the red and processed meat, and also the alcohol, I will talk a little about the quantities. So all these 4 things, at least we cut down or we limit, is what will become very important. And like sir just spoke, a plate of meal which we eat on a daily basis should have a certain quantity of protein, a certain quantity of calories or sugars or carbohydrates which we talk, and a certain quantity of fruits. So to measure this is very important. We need to understand, or we need to be very much aware of what we are eating. So both in our breakfast, lunch and dinner. So all in all, we should include more amount of cereals, wholemeal foods, legumes, beans and veggies and fruits in more quantity and less quantity of what I was just showing. So the second most important thing in terms of preventing cancer is definitely exercise. The World Health Organization is being very vocal about this particular thing, at least in diabetes and hypertension. They slowly realize that exercise is also very important for cancer prevention and also in terms of the treating. So what all cancers will be at high risk if you are not following a proper exercise, I am just showing here. So breast cancer, your female uterine cancer, the kidney cancer, the bladder cancer, the esophageal or the food pipe, or the stomach cancer and the large intestine cancers, all these 7 common cancers which we deal in a regular basis are at high risk if you are not following a proper exercise schedule. So, and the other cancers which can be a causative factor because of your increased abdominal obesity per se is what is mentioned here. So, few brain cancers, the thyroids, the food pipe cancers, the female breast cancers, the livers, the gallbladder and the stomach and pancreatic cancers, and also your large intestine cancers. All these cancers, the obese people are the ones who have abdominal obesity per se are at increased risk for these routine cancers. Even your ovarian and endometrial will be at higher risk if you have an increased abdominal girth or your abdominal obesity. So, talking about a few risk factors, the most important thing which puts general population at high risk is definitely smoking. So all these 12 common cancers are the ones which are related or at least directly or indirectly to smoking. Smoking, there are 2 different types of smoking. The chewable tobacco ones, and the non-chewable is what we smoke with cigarettes or the other chuttas and bidis which are done in the rural population. So the smoking, whether it is chewable, will increase your risk for your mouth cancers, the throat cancers, and also the food pipe cancers, and also the voice box cancers. If you are doing it on an inhalation basis, that is your cigarettes or chuttas and bidis, that will increase your risk for the lung, the stomach, the large intestine, the uterine in females, the cervix in females, the bladder, and also the kidney. So all these 12 different kinds of cancers have a direct link to tobacco. When I'm talking about tobacco, the more a person smokes, the higher the risk will be. So we calculate the smoking or these particular risk factors in terms of the number of cigarettes or the number of years they have smoked. So if a person has smoked at least a pack of cigarettes in a day for more than 10 years, so that is called 10 pack years. So 10 pack years, then we calculate again in 12, 15 and 20. So 10 pack years, 15 pack years and 20 pack years. So more than a pack of cigarettes in a day for at least 10 years will increase your risk for all these cancers. Specifically lung, if you have smoked for more than 15, and also the other ones if you have smoked for more than 20. This is the ones which you are smoking. Let's say someone is